am.
We want to talk about parents' betrayal. Okay, you can start with your example. I was listening to you when you were saying sure. Okay, guys, we were talking about parents betraying. Let me start a little bit when we talk about immunization. So, there's a lot of controversy. People say that everybody needs to be getting immunized, but parents have the right, they can refuse it, But in certain situations, the law takes over, okay? We're going to discuss one situation. I think it's with adult. Is it adult? What's the adult person?
The what?
The one you were talking about.
Okay, adult geriatric patient.
Okay, adult geriatric patient. Usually the law takes over if it's a children, like a child, they cannot speak for themselves, or the one who's cognitively impaired, okay, unconscious, or sometimes they don't have anybody to make their decisions. Okay? So in those cases, so tell us your story.
So I have a client who has claims that has no family member, nobody to oversee her medical and her estates and everything. So what they did was the court appointed someone to her so that way they can oversee her things. So like when she dies, she can make a decision of where maybe they already discussed about it, like where her things will go since she has no family member, nobody, not even friends, anybody to leave those things with, or make a decision for her health. So the government set up somebody for her to oversee all those things.
So when she passes away, where do all these things that she has
Yeah, so what happens is in that case, from my understanding is like if she passes away, so they can give donation to like, I don't know, maybe help other causes to the community or something. So all this is already like set up. We should have a will written out already, all the stuff before she became mentally impaired. So that's what's gonna happen. So they donate, they can make it for good cause. So that's what we're hoping that whoever they charge is honest person and all that they're not gonna take your money and all that. So that's what the court. So he has to go check into the court and give progress to the court and say, hey, this is what's going on, this is what we've done, this is the treatment she's getting, all this stuff. So that's how.
Okay, Nick, read the definition of parent betrayal.
The government or any other authority regarded as a legal protector of citizens are unable to protect.
Okay, so why I brought it up in immunization, the parents has a right, Like even though when we take the consent from the parents, they have the right to refuse it. Okay, we can't mandate vaccines on everybody. Okay, in cases where do you think as a nurse or the healthcare provider, if the child is not immunized, the parents are putting the child at risk. Okay, like child has asthma, COPD, or some congenital disorder. Like if you don't immunize them, or immunocompromised person, or diabetic person, in those cases, we can still bring this law in. Then the law can protect parents' rights. So basically that's it. So normally if it's a normal, healthy individual, parents can refuse it. But if it's a sick child, as a provider, I think that she's making a wrong decision for the child, you can always go seek help from here. So that's the parents' betrayal that comes in our immunization. How much controversy goes on in immunization. Should be mandated, should not be given. Everybody has their own opinion,
When I was working in the ER, we would have kids come in and they would suspect abuse. And they would kind of throw this out there so the parents could, it's kind of like they became more of the state almost, but it was within this.
It was better than that?
Yeah. They would
Yeah,
have to call
how to do that's what it comes under like medical abuse. Yeah. Child abuse is the physical, emotional, financial, the medical is one of them. Under medical abuse, you will see the parents portrayed, instituted by the law. So let's review the immunity. So we already did gas exchange. So in gas exchange, we just did it here. Some of them we did talk about the immune response with the inflammatory stuff. In an immunity, we see that. Let's talk about immunity. from the microorganism or the foreign bodies. I just said anything foreign. It can be a microorganism, can be a leaf, can be a table, anything that does not belong here. Okay? So what is the things that are protecting us? If you look at that, we have intact, non-specific defense barriers. Skin is one of them, you know. Then we have a functional lymphatic system. What does the lymphatic system do? It's like a venous system. Venous is the like a take dirty blood. Lymphatic system takes all your exudates. Okay, anything that is not ingested by the macrophages with the phagocytosis, anything that left it drains in the lymph. Okay, so then it gets absorbed through there. Optimum innate immune system. What is the innate immune system?
You're born with it.
You're born with it. Okay. Functional inflammatory response. Like we saw that when there is any inflammation, okay, what happens? Why do you have redness over there? Because your blood cells comes over. That's our normal inflammatory response. Person gets hit, it gets red, okay, then it starts getting little grayish color, okay, so that's the normal inflammatory response. Then the white cells start coming there. That's why our white cells go high up in infection, because body is sending those soldiers to fight with the infection. Okay? When the white cells goes up, there are macrophages, so they're killing those microorganisms. Now the microorganisms should be taken somewhere by somebody. It can be a phagocytosis, you know, so or they can be moved to the lymphatic system. So that's how they get rid of all those exudates in there. Then we have adaptive immune response that's acquired, okay? And what is vaccination? We know that it's acquired. You know, it's not, we are not born with it. Is it active or passive? It's an active, okay? It's an active acquired immunity vaccination, immunization. Okay? So that's what the main goal with that too. Break in a non-specific defenses we will be discussing in cellulitis. Okay? Also a little bit into the osteomyelitis. Inflammatory response, we'll be doing appendicitis comes under there too. And all your cycles, UTI, they come under there. Only thing under adaptive required comes in the immunization. Vaccination is the one that we discussed in the acquired active immunity. So, are you guys aware of the infectious response? What happens with the first site of infection?
Inflammation.
Uh-huh.
So it's inflammation.
Go through all the inflammation steps. During an infection, you have an invasion for the microorganisms. Okay? When the microorganisms take over, so that's, let me just review that with you guys too. That will make a little bit more sense. I think I did change it from your 1430. Did you not just in 1430? Yeah, this is all your 1430. So that's why usually we don't repeat it because we expect that you remember it. So you see that? Yeah, that's why I said go through your information then. Yeah. So you see that no, this is an immune response. I asked for infectious response. Inflammatory response is different, immune is different, infectious is different. You know? Inflammation, the one we already discussed it. In the immune response, you see that this is all your inflammation going on, but then your complement system kicks in. Okay? I don't want you to remember complement system. There's a gazillion plasma protein. Okay, we call it antibodies. Okay, that kind of a help. Go there and help. That's like our soldiers too. So there is so many cascade system in a complement system. So that's the part of immune response. You know? Why we get tested for hepatitis? Which one you guys need immunization for the titers? Which? B. Hepatitis B. So hepatitis B, why we check for titers? We want to make sure we have the soldiers. We have the immune response already produced through the vaccination. when you do the vaccination, what we are doing it? We are producing the immune response, giving the antibodies that can help and so that's what is your complement system. But if you look at the whole complement system looks like, crazy. So these are the main antibodies. You know, we have IgM, IgG, IgE, and IgA. Did you learn that?
Yes.
Okay, so you don't need to be knowing that, but you kind of get familiar with it. Like you have inflammation first, then you have immune response. In the immune response, your body is responding to inflammation with the phagocytosis, chemotaxis, sending all the blood cells, okay? Then the further when immune response kicks in, you might have IgGs, IgMs, they help to fight with it. Let's see what is infectious. I think that we discussed probably under. Yeah, it goes under, I think, exemplars. So usually your infectious responses, including inflammation, including immune response, okay, and also your body start having like a fever, showing other symptoms. So those are the three things that we'll talk about usually. But in our immunity concepts, we'll be talking about infectious and inflammatory. Immune response only we talk about into the vaccination. So that's your acquired active immunity. And the positive is look at your skin is intact, is healing, your body, okay, all your autoimmune diseases, they come under impaired immunity. Okay? Because your immune system should have an ability to recognize what is self, what is foreign. What happens in an autoimmune disease? Body, they recognize self as a foreign. Okay, so that's why that's there. What drugs we use? Immunosuppressants. You know, it's a hyperimmune response because they're attacking our body. So you need to suppress that response. So that's what we use, immunosuppressants. So then the demonstration of abnormal cell growth, that you'll be discussing as a cellular regulation. That's in semester 3, all your cancer. All your cancer things, they come in a cellular response. Then it protects from the invasion of microorganisms and antigens. Okay? We know that antigens are the enemies and antibodies are the soldiers for our body. The negative, we will be discussing about infection, localized and systemic. Localized, we'll be talking about appendicitis, cellulitis, osteomyelitis is kind of in a bone. The systemic is usually after the UTI, it's like a more septic, you know, sepsis or septic shock. No cancer, no immunosuppression, no immune deficiency, we're doing it. Chronic inflammatory, I don't think so any of our fits in there. And so we'll be discussing comfort mobility tissue, like how as we go with the, okay, let's see if somebody has appendicitis. Okay, what will be the effect of mobility on appendicitis? Impaired mobility. The other thing is when they move, they guard the side. When they're in pain, they walk like this. Because when they extend it, it hurts more. So that's what the sign is that you see for appendicitis. So usually you see that when they lie in the bed too, they lie like this with the bed knees. Because extension makes their pain worse. So the other thing is I want you to remember all your labs for immunity, normal WBCs, and I think there's a few as we go.
As far as labs, you wanted to know the labs from our Lewis book because you gave us like a big sheet of labs in one of the PowerPoints.
It's totally different, isn't it?
They're different
Yeah.
than what the Lewis.
Yeah, just do the Lewis book.
Okay.
Yeah, do the Lewis book, yeah. Whenever we talk about some lab values or something, just follow your Lewis book, okay? And in the exams, they will give you, but they're very close to.
Yeah, I did notice that.
Yeah. But by the time you get there in 4th semester or ready for your endpoints, you should be able to make it, doesn't matter which they use it. So you will start seeing it, okay, that's not that much difference, that's not that difference. So you remember one. Okay, the biggest one is pneumonia here. Let's do that. So we already discussed here, okay? We already discussed that pneumonia is a gas exchange problem. So we know that there's a very close relationship between gas exchange and pneumonia. So now we are going to see in immunity point of view. So we already talked about aspiration pneumonia before. So now look at that. In pneumonia, it's acute inflammation, it's not chronic. Okay? It's acute, and where is the inflammation? In the parenchyma. In the parenchyma, the internal layer of the lungs, and different causes. Bacteria, virus, fungi, mycobacteria, they are all foreign organisms. So what kind of a response they are going to stimulate in your body? Inflammatory, infectious, immune if you have vaccination or, for the pneumonia. So you see that which defense mechanisms are impaired here, just like we discussed previously. If mucociliary mechanism is impaired, okay, your cilia are not able to recognize that this is something that should not belong in the respiratory tract, and they keep on letting passing it. And so all the pollution, cigarette smoking, upper respiratory infection, tracheal intubation, and aging. So these are some of the conditions that impair the mucociliary response.